So I'm with Dr. Maseka.
Hi, hi.
We are at UTH.
Yes.
So we are going to talk about
Urinary tract infections.
exactly. She works here. She's an OBGY. Yes, I've tagged her page, so you can go and look what she does on her page.
Thank you.
You're welcome to your midwife page. So you can just introduce the topic.
All right.
I'll come in.
Thank you. So we're going to discuss urinary tract infections. Basically, we talk about what is UTI, what are the causes, how do you manage UTI, what are the natural things that one can do to sort of like, if you want to avoid antibiotics, what can you do to sort of like help with the urinary tract infections? So feel free to ask your questions. You can just. All right. So urinary tract infection. This involves urinary tract infection. These are just infections in the urinary tract system. That is to urethra and of course the kidneys. So it starts with the urethra. If not handled well, it will ascend all the way to the kidneys. So urinary tract infection, as the name suggests, is just an infection in the urinary tract, which is a tract from the urethra all the way to the kidneys. So what are some of the causes that that predispose? First of all, before we discuss causes, anatomically, women have shorter urethras. You know, the urethra is normally 3.5 to about 5. They're about 3.5 to about 5 to about 5 centimeters. That's a normal. While in males, it's about 25 centimeters long. That's why you find urinary tract infections are rare in males, but more common in the female. Worse off when a woman is pregnant. When a woman is pregnant, UTIs become very common. The reason is because you find that the changes that pregnancy comes with would predispose this woman to getting the UTIs more and more. Well, I've seen Cleopatra. Thank you so very much for logging in. I've seen Chavala. Thank you, as well as Palace. Thank you so very much. Well, Cleopatra is asking, what is yeast infection? Well, yeast infection, we'll talk about it on another day, but for today we thought we could discuss with you urinary tract infections.
Which is very common. Urinary tract infection is very common in pregnant mothers, as well as in just us women. So the urethra the doctor is talking about is where the urine passes, just in case someone is confused, is Googling what urethra is. You can go ahead.
Exactly. So in females, where the urethra is found, you know, like we have two openings. First of all, let's imagine that clitoris, which is like that, just under the clitoris, that little pointing thing. Under it, you find that there's an opening that is called the urethra, where your urine comes out from. So some of the causes of UTIs, of course, commonly it's infection, which there may be different infections that may cause, but also habits play a role, like our habits. Some of the things could be habits, Brenda. Like sex, for example. Sex
Yes.
can cause you to have UTI because as you're rubbing over the urethra, therefore infections can ascend there. What else, Brenda?
So like on foreplay, make sure that your partner needs to wash hands, because if your partner just touches you just here and there with dirty hands, it may cause UTI. So make sure that as you go and start the things in the bedroom, make sure that both your hands are clean.
Good. Then the other thing besides your hands is ensuring that you actually, even just taking a shower, that can help. And also ensuring that after the act itself, you go and urinate.
Urinate, yes.
Exactly. But of course, other things could be using dirty toilets, dirty bathrooms. You know, our urethra is on the outside for females. So you find as you're using the dirty bathroom, you get infection ascending, coming in.
Also soaps. So we discourage using soaps when washing our private parts, and make sure that you don't wear those parts. Mama pants are not right. What cotton is that?
Polyester.
Yeah, polyester. So let's avoid those things. They cause UTI in pregnancy.
Well, other things that can predispose a woman to having UTIs. These are just, remember what really causes infections, but there are habits that can predispose. Some of the habits is not you drinking enough water, and also the habit of where when you are pressed, you feel like going to the toilet, but you still hold on to your urine. So those are some of the habits or behaviors that can actually make someone to have UTI. So how then can we handle UTIs? Like if you don't want to go the drug way, are there other things that one can do? Typically, because it's an infection, we want to treat UTI with antibiotics. But remember, antibiotics alone may not really work, or they can work, but then because the habits are still there, you find yourself having recurrent UTIs. Now, before we talk about how we can handle them, perhaps we should talk about the symptoms. Yeah? So one of them is, Brenda?
Burning sensation. You'll be feeling like you want to go to the toilet. Some they usually feel when you go to the toilet to pass urine, you may feel a burning sensation.
Exactly. So that burning sensation typically is at the end of your urination.
Yeah.
The other thing is really waking up several times at night to go and pee. So if you wake up more than 3 times, you wake up more than 3 times to go and pee, the chances of you having a UTI are very common. So there's issues of frequency where you pee a number of times, especially at night. Issues of where you're feeling like your bladder is full, you go to the toilet, it's only a little bit that is coming out. And of course, the other thing that Brenda talked about. But besides that, sometimes when it becomes severe, you may have a bit of a backache, and also lower abdominal pains, also pains in the flanks. We call them the flanks, behind here. When it goes behind, then it's more of the infection has ascended to the kidneys. Okay? So typically those are the symptoms. So how then do we manage these UTIs? Like I said, we use drugs to manage the UTIs, but there are also ways we can look at to try to help us, even as we have, to try to help manage the UTI. Some of them just include ensuring that before you get in the act with your partner, you are clean. You take a shower. After that, well, you want to go and urinate and really clean up. Then some of the measures, those are some of the measures that we could take. Other measures are ensuring that if you go to the toilet, for example, you're going to do a number 2. You want to wipe yourself starting from front going to the back and not the other way around. Because remember, if you wipe back first, which is the anus first, coming in front, you are bringing organisms. You are bringing in those bacteria and whatnot, you're bringing them in front. Well, other practices that we could do include ensuring that we really avoid things that could, like your hands are not clean, you're trying to touch yourself, or maybe using these soaps, that could just be a predisposing factor to having UTIs. There are a number of natural methods that people can do in order to sort of like help themselves when they're having these UTIs. But remember, the primary thing in handling UTI is your antibiotics. Usually we want to do what we call a urinalysis, just to look at the urine, how it is, and thereafter we can also do a urine microscopy to culture it and see which bag is causing those infections. So remember, UTIs can be very troublesome actually, if not handled well. They can be quite troublesome.
Yeah, UTI also can cause you to go into premature labor.
Exactly.
Before term.
Exactly.
So make sure that when you have those signs, which the doctor has mentioned, you go as soon as possible. On this page, we encourage going to the hospital.
Exactly.
So if you have those signs of having UTI, make sure that you go to the hospital as soon as possible so that you are treated.
Yes. Well, I can see Ruth. Thank you, Ruth. I can see that you're saying you're in pain and you're asking what you could do to stop it. Well, the best you go to the hospital, get someone to see you, and they assess where the pain is coming from. And based on where it's coming from, they'll be able to help you. Really sorry for what you're feeling. Thank you, Roland, for following and commenting.
Something meaty?
Oh,
Yeah.
interesting.
Exactly.
That's nice.
Yeah.
We are grateful for all those that have logged in. So really, UTIs can be quite problematic. So there are a number of natural things that people use to sort of like just help them. One of them is cranberry juice. You've heard of cranberry juice,
Yeah,
right?
yeah. Cranberry juice, you can find it in ShopRite or Pick and Pay. You can just buy it over the counter. It really helps. So make it a habit of buying cranberry juice. Also, natural yogurt. You can buy in Zambia or ShopRite. It's available everywhere. Natural yogurt is very good. I hear it also prevents fungal infection.
Well, yeah, natural yogurt is good in that line, yes. It helps with a lot of candida, these fungal infections. So cranberry juice comes as a juice, but also you can get them as cranberry capsules, which are common in most of the outlets.
Yeah.
Besides that, there are also things like your soda water. Soda water is actually, and your green tea, those are actually some of the things that we take naturally, which you could actually take to help with a UTI alongside your antibiotics. What else? I think hydration.
Hydration,
Very
yes.
important.
At least you need to drink water, small but frequent. At least in a day, you may drink 1.5 liters of water. It may help you. And make sure that you are going to the toilet frequent. Do not hold on to urine. So make sure that you are emptying your bladder frequent. Stella is saying pain during urination.
Yes, so typically, Stella, with UTI, you find that you have a sensation, it's a discomfort or pain following urination. That is very, very common.
Yogurt we drink. Yogurt you can eat. The natural yogurt, it comes in like a small or big. You don't drink, but you eat it. It doesn't come as juice, no.
Okay, yeah, so, and something personally I've found to be very helpful as well is clove tea. Clove tea is very good in managing UTI. I've used that a lot. I've also used soda water as well as green tea. Those help, but I don't do them alone. Usually, they work better. These things like cranberry juice, soda water, green tea, clove, they work better if the infection has not yet set in. Like as prophylaxis, as part of your daily taking, they really work better. But once infection sets in, you want to use your antibiotics and ensure that the infection has been removed. Thank you, Amy. Amy is saying something.
I was diagnosed with UTI in 2015. Up to now, I have not been able to conceive. Is it possible to conceive? Because I've been to the hospital. They said everything is fine with me. I was scanned and given antibiotics, but okay, Amy. Infertility issues. It's not you alone. You need to go with your husband so that both of you are tested, isn't it?
Exactly. So remember, it takes two to create a baby. So 50% from dad, 50% from mom. So fertility issues are handled. You have to handle the couple because there's some tests we do on the female and also as well as on the male. Well, UTIs per se cannot cause infertility. No, they don't cause. The two should not be mixed. They don't cause infertility. Infertility is caused by other things, which when you go to the hospital, the doctors will be able to investigate and treat you likewise. Okay. Well, we thought we could share with you on a Sunday morning.
On a Sunday like this, we thought we could share UTI in pregnancy with Dr. Kindly follow. I've tagged her page. Kindly follow through so that we can be learning together. You learn on your midwife, you also go learn on her page.
No, thank you so very much. So we'll still stay in waiting for questions. Please do ask your questions and still interact. Honorable Fox, Aaron.
How does one cure masturbation?
Wow, that's an interesting question. What do you think, Brenda?
I don't know.
Well, masturbation is an act. So really, I think in terms of curing it, maybe what you mean to say is how can one stop that?
Stop it.
So it begins with deciding to not want to engage in that act. And of course, it takes a lot, like you have to commit to your decision. Even when you feel like doing it, you commit to not doing it. That really helps. And finding ways to distract your mind. Like, for example, if you're feeling like doing it and you can do something to distract your mind at that time so that you don't find yourself in that
doing it.
Exactly.
There are lots of things you can do when you feel the urge. Kindly move out of your house and have a chat with your friends. You can go to the market, you can go and watch football.
Exactly.
Extra.
So in short, you just need to distract yourself.
Yeah.
And what's important is, first of all, identifying that you need help and that you need to decide. Once you decide, stick to your decision. It may not be easy, but once you're committed to it, it definitely does work.
There's another question from Ruth. Is it normal to have headaches during pregnancy? If yes, what can I take to stop it? Ruth, we discourage self-medication and we discourage prescribing medicine before you are seen by the doctor. So we encourage you to go to the hospital because headache in pregnancy is it's a danger sign. I always say it's a danger sign. It may be an indication of preeclampsia. It may be an indication of anemia. So please kindly go to the hospital so that you are seen.
Exactly. You see, you only have one life that you have. You must ensure that you take care of yourself because it's better to be healthy and not to risk. So when you're not well, the best is you go to a health facility where there's a doctor and you get seen and given the medication, or if you need to be investigated, you're investigated.
And where's that question? This one was passed. We'll talk about diabetes next time. Today we are just focusing on UTI and pregnancy.
All right, maybe for those of you that may be wondering,
are you a tele-doctor?
Yes. I am. So for those of you that may be wondering, with clove, I love to have clove and cinnamon. It's very good. So I buy my cinnamon sticks and the clove, not the powder. Both of them are not powder. And then you boil your water, you put your clove and the cinnamon. I like it without sugar, just plain as a tea. First thing in the morning on an empty stomach. For UTI, it works like magic. You take it twice a day, it works. Those are spices that are common in our kitchen that we use, which you can still take to help you with those symptoms. But of course, don't forget to always see your doctor or your health worker if you're not feeling well.
Doctor, can UTI and CS cause infertility?
CS, that's Caesar. No. Those two cannot cause infertility.
Oh. question. You tell the doctor you've already answered. I feel bloated. What should I do?
Oh, hi, Chambo. That may be very uncomfortable feeling that way. Well, there are a number of things that cause bloating, and there are a number of things that I think help relieve the bloating. It's an uncomfortable feeling. I know of gas off, and I know also of, I think, okay, now I can only remember gas off. The other ones I can't remember, but that helps. There's also that thing that you put, like the name has got in water.
In water.
It's such a, you put it in water.
Something.
Exactly. That one also helps with bloating.
Can one still use powdered cinnamon and cloves?
Well, I personally like them poured. So I get my cinnamon sticks. Also the clove, you get that my little sticks, not the powder. Then you boil water and then put them, and then once it simmers, you take it. It's really good. Not only for your UTIs, you can actually look it up. A lot of studies have been done around cinnamon and clove, issues of hypertension, issues of controlling your blood sugar, also helping you not to really eat too much, because clove itself can control appetite.
Just natural spices. They help in everything. They at least they reduce some symptoms.
Yes, they do.
Close.
Well, are there still any questions?
Are there still questions? I think there are no questions. Thank you so much for tuning in, and make sure that you like Dr. Maseka's page.
Thank you.
Have a